Hi, Mrs. Wilson. I'm Dr. Johnson. I'll be your primary care provider. It's so nice to meet you.
Hi, Dr. Johnson. I'm Sally. It's nice to meet you too.
How are you doing today?
I'm doing pretty well. How are you?
I'm doing great. Thank you for asking. I just got your cholesterol results from Dr. Navarro. I look forward to working with her to keep you healthy. Let's go over these results together and talk about what they mean.
Okay, great.
If you look at this screen, there are 4 numbers that really determine your cholesterol results. These numbers are used to determine if you'll need a medication for your high cholesterol. What questions do you have for me?
So, what do these results mean for me?
Well, these numbers influence your risk of having a heart attack or a stroke in the future. But there's more to cardiovascular disease risk than just cholesterol numbers. We also need to take into account your blood pressure, your age, and your sex, your smoking history, whether or not you have diabetes, and the fact that you have rheumatoid arthritis. We use a risk calculator to estimate your cardiovascular risk base on all of these factors. Let me show you how this works. All right, your results from the risk calculator is about 3%. That means that about 3 people like you in 100 will have a heart attack or a stroke in the next 10 years. Even if we factor in your rheumatoid arthritis, the risk is still well below the recommended levels for starting a statin.
I spoke to my pharmacist about statins and looked up some information on the PALs, but I want to hear from you what exactly they do.
I'm very happy you're being proactive about your health and getting more information. To answer your question, when patients are at a high risk of cardiovascular disease, statins can help lower bad cholesterol levels like LDL in the blood and reduce your risk of having a heart attack or a stroke.
Oh, I see. A statin does its part to protect your heart.
That's exactly right. You should also discuss this with Dr. Navarro. With your low risk, I don't see a reason for putting you on a statin at this time. There are some recommended things everyone can do to keep their risk low, though. Let's talk about healthy eating and the amount of physical activity you're getting.
Okay.
A statin does its part to protect your heart.
PALS, Patient Activated Learning System.